We are the custodian of health information for that is used for research, teaching, and even publication.
Exactly.
For doctors, nurses, and other health personnel, they use our records in treating the patients because that's what we present to them previous history of the patient,
Yes.
and then the present problem that is facing will also be entered, and that's what they use in treating the patient. So there's no way any other profession will not know the existence of health record.
Health information
Health information,
officers.
yes.
Happy about what is happening in Nigeria. Look at you will see hospital will go on strike, health workers will go on strike.
Yes.
Yet the government will not do anything about it. What they will do, they will only be promising. At the end of the day, they will not even do anything. You see, these are the root cause of decaying of our own hospital, medical tourism in Nigeria.
Yes.
So, and I want to appeal to the present government to look into all this and make sure the health sector is given a proper attention. All those things that are not there, let it be there. And I want to sincerely tell you, if you go to Europe, you see the best physicians there. If they call them, you see it's a black man. A black man from where? From Nigeria.
Imagine.
You can now see our people are doing very well when they go outside because all the facilities are made available and they are living a very comfortable life. And that is why they are living.
Yes.
In your own country, your motherland, you are putting your best, and your motherland don't even appreciate what even you are doing. It is a very unfortunate. My prayer for this nation that God should touch the heart of our leaders to think twice and know that this is their fatherland. They don't have any other land country than Nigeria. So and nobody outside will come and make Nigeria great. We are the people to make it great.
Yes.
So that is my own appeal to our leaders in this nation. They should look at the health sector very, very well so that we now regain back our past glory.
Okay, against that background, because you hear the doctors or the nurses say it's against our ethics to let out information of our patients. How do we handle you people, the record keepers?
Yes, our practice is based on confidentiality because if the
Good.
president attends my facility today, I have access to his record. So at the point of induction, we take the oath of secrecy, where we talk about confidentiality of the patient record. If you are not a practitioner, you do not have
Access to that information.
No. And then even within the department, if you are not in the library where records are kept, you have no access to the library in order to be able to maintain the confidentiality of the patient record. And then even in the electronic environment, because that's where the new emerging trend in our practice is electronic health records.
Right.
Even in that environment, we ensure too, if you do not have access, there is limit to access to
Accessibility
information.
to
Yes.
information.
Except you are in that unit where you have total, you are the admin,
Yeah.
you cannot have total information concerning patients. So
Okay.
confidentiality of record is our watchword.
To follow up, how can you perceive this profession in Nigeria?
We are thriving, we're moving,
Yes.
we are evolving.
Yes.
We've been there for over 50 years, not known really, but these days of electronic medical records, electronic health records, we are now evolving and we are getting to
And you're
that
expanding.
limelight. We expand.
Okay, right.
People are getting to know us better because
Exactly.
they now know the value of data in the information-driven healthcare system.
Against
They
that
know
background.
without data, they can't move anywhere. They can't do anything.
Against that background, how proficient or how efficient right now is our database in the medical department?
Well, worrisome because we don't have a data bank. Then there's no interoperability. We cannot link our data from each center. Most of the
Wow.
data
How is that?
there is normal in Nigeria. Anything to change, it's like that. People they resist. They don't want to.
move
Right.
with what but at least with continuous professional development, education, advocacy.
Do you
That's
think
the
this
thing.
can really improve our health sector?
It can, because if we have people who are not professionals or
Yes.
people who are not well trained, who handles data,
Mhm.
what they will bring out will not be the correct information. But we are trained to collect, collate, analyze, and present the data. So if the people that are brought into the department are not trained to do that, then the government might not have the correct information they are looking for.
To improve the health sector in Nigeria.
Mm.
Okay, quickly, the health information officers, do they have particular look or particular uniforms? Because I just know Nigerians know nurses, and these ones, you are the professionals, just like at the background. Do you have a particular look or uniform you wear for at a go? Somebody will just say, yes, this is a health information officer.
Yes, we have our scrubs,
Okay,
and we also have the lab coats, our white lab coats.
okay,
So we could wear the scrub or the lab coat,
okay.
and we have the inscription of the name of our profession.
On your lab coats. Okay.
Though this varies,
It
depends
varies.
on facility.
And the colors, do they vary or just white?
Colors vary. Colors of scrub varies.
Varies.
Yeah.
So are you saying that, because let's quickly educate the public a bit, are you trying to say that once you need information in the hospital, you don't go directly to see a doctor or directly to see a nurse, you ask for the health information officer? Is that what we're looking at here now?
When you need information,
Yes.
you see the MD. We release information only to the MD. If it is an information that is to be published or that is going to the federal government, we only
Right.
take custody of the information. We collect it from patients.
Right. Official records, you mean?
Exactly.
Okay,
So we
okay.
take it from the patient and we keep it only to be released on approval. So when
By the
patients also
doctor,
come to
okay.
ask for their personal information,
Information.
we also get approval from the management before it is released
Oh,
to patient.
really?
We only take custody of the records.
Right.
And whatever information is going to the federal government, the information comes from our desk
Wow.
because we keep primary records. Every other information you get is from the records we keep.
Yeah.
So if we don't have people, if we don't have qualified people manning these sections or
Yes.
handling this assignment, definitely the information that will be going out might not be
The correct information.
exact.
Quickly, why do we need digital database right
Because
now?
the issue of storage of records has been an age-long problem in the practice.
Right.
No matter how big your storage is, one day to get filled up. But with the computer, you have unlimited space where you can store as much as you want.
Right. Thank you very much for speaking to FOSA TV channel on
Thank you
this.
for having me.
Thank
What
you.
are
Your recommendations to federal government concerning health institutions in
You see, one of the
Nigeria?
problems we have in area of health management is funding.
Good.
Is funding. Because if we talk about poor internet, poor this, poor that, if we have enough fund, you can have this. Okay? So let the federal government really be conscious of the need for information and let the political will be there. There is need for political will, and there is need of being very focused and say, yes, we want to develop health information. It should not be a political statement. It
Okay.
will be something that there should be a drive, a serious, how do I put it now?
A serious campaign or awareness.
Campaign. The awareness is there.
Okay.
It's not real
serious
serious
campaign.
commitment.
Commitment,
Yes,
okay.
there must be political will and there must be commitment.
Good. Okay. All right. Thank you very much, sir, for speaking to FOSA
welcome.
TV channel
You're
on
welcome.
this, because I know this. I also learned. And anyways,
It's okay. We learn every day.
yes, because in the medical sector or health sector, we just believe that
By
it's
the
all
doctors.
about doctors
Yes,
and
it's
nurses.
not about, there are so many other
We have
professions.
professionals.
It's a team. It's called a teamwork.
Okay, right. Very good. Thank you very much,
You're
sir, for
welcome. It's a
enlightening
pleasure
us on
meeting
this.
you.
Thank you, sir.